Okay, let's start with some MI complications. So here is this patient is MI, and now let us say after 2 months. By the way, MI complications look at always to the time frame. So after 2 months now, the patient who was MI and everything was okay, but comes to you with these symptoms. So he has some shortness of breath on exercise, or maybe simple exercise. When you auscultate the patient, you will hear a kind of crackles. So what's this indicate of? These indicate now the patient has heart failure. Now, not this is the question. This is just a complication of post-MI. Now, let's go back to this. Let's go back to this curve or to this diagram and see how the heart failure. Now, what is the problem of heart failure in this patient? Heart failure means decreased cardiac output, right? Okay, so let's go. Why I have decreased cardiac output in post-MI patient? Why I have decreased cardiac output in post-MI patient? Now, the main problem is this. Because of severe MI, now the tissue will be converted to scar formation. Okay, now the tissue converted to scar formation, and the result of this scar, now the wall is non-functional. Now I will have a complication called aneurysm. Again, this is really much more important, because a lot of people just confuse. They think scar tissue is weak tissue and the end of scar tissue is rupture. But this is wrong. The end of scar tissue is aneurysm, and the result are now as a result of this aneurysm, because part of the heart is not moving. Now you will have decrease in cardiac output, and patient came with heart failure. Now, maybe not this is the questions. Maybe the questions will be, what is the cell that is responsible for heart failure in this patient? I mean the first cell. So you have to go back. So the scar formation, what is the cell responsible for scar formation is fibroblast. Usually fibroblast becomes to work after 1 or 2 days of MI patient, but needs time for deposition of collagen. And put in your mind, in first few days, always in first few days there is collagen type 1, and after 1 month this collagen type 1 in the first few days there is collagen type 3, and after 1 month this collagen type 3 converted to collagen type 1. This is general rule for any cellular injury. Again, so the main pathology here is the scar formation, and the scar formation leads to aneurysm, and because now the wall of the heart is not moving, so I will have decrease in cardiac output. Again, if the same patient now but come with another complication, now the patient come with stroke, that means there is an embolus formation. If it is stroke, that means I have an embolus formation. So let's go back to the illustration again. That means he has a mural thrombus, right? Because of this thrombus and now embolus to the brain. So why will have a mural thrombus in this patient? Again, because of aneurysm. Because of aneurysm, now he has stasis of the blood because of this aneurysm and now mural thrombus. Maybe not this question. Maybe the question will be, what are the prophylaxis in this patient because of a mural thrombus? So the prophylaxis will be anticoagulant, which is warfarin. And maybe even now this is not the question. What is the mechanism for warfarin? It is actually gamma carboxylation inhibition. So gamma carboxylation, now the question want to connect some of biochemistry, pharmacology, pathology. So it is gamma carboxylation of the 10, 9, 7, 2 factors. This is the anticoagulant, which is usually used for a patient with aneurysm to prevent any mural thrombus formation and to prevent stroke.